So, having been passed on from the hospital, finally got a referral to the assessment and brief treatment team, and went for the initial assessment, and going into the room with a woman. I'm sitting there and she's just sort of making small talk about the process. I said, look, I'll be honest with you, from my previous interactions with therapy, I recognise that it's just a preset process. It's an agent delivering a package to an end user on behalf of an agency, and that's all it really is, because nothing really alters. It's just this sort of structure that I'm meant to fit to, but no one really wants to lay out the package to me. And she said, oh no, it's been a long time since you was in therapy or had anything to do with therapy, so it's all changed now, it's all very different. And then I'm like, right then, we carry on with the questions, and she's asking these questions, typing my answer, and then we get to the third question, and she's struggling to type up my answer. I sort of ask her like what the issue is, and she's clearly not happy. She's sort of frustrated, and the way she put it across to me is that she's trying to type it up but doesn't know how to type it. I'm like, what's the problem? And she's put it across to me that she needs to type up what I've said in her words as a reflection of what I've said. And then she's got all confused and gone, what did you say again? So ask me the question and I'll answer again. So she asked me the question, I'll answer again, and she's sitting there, she's still stuck. So I said, maybe if you turn the screen round, maybe I can help you actually type it up, which she's done. And then on the screen there's lines of bold writing. So there's a line of bold, then there's a line of sort of normal print, normal font typed underneath, and a line of bold, normal font typed underneath, and then a series of lines of bold writing. I said to her, okay, you see the bits in bold? She went, yeah. I said, are they the questions you're going to ask? She's like, yeah. I said, you're going to ask any other questions than those? She went, no. I said, you're not going to find any information from what I'm saying and create your own questions as a result of that? She goes, no. I said, right, well, at the start where I said all this is a preset process of an agent delivering a package to an end user on behalf of an agency. You said it isn't. But what is that? That's a preset package. You're operating on behalf of an agency, therefore you are an agent, and who are you delivering the package to? Me, an end user. And anyway, she started getting frustrated and treating me like I'm being awkward. And what I noticed in certain things is she put, he feels like. He feels that. And it's not a case of feeling, I'm giving statements of fact. And like one of them was, where is that one? He feels that he has been a target for his family and was not wanted as a child. No, it's a fact. So I have stated that. Because of my previous interactions with the therapist in CBT, where I'm explaining how everyone literally did have a problem against me, how I was just a target for abuse. And then all he kept asking was, why do you feel like the world is against you? I don't feel like the world is against you. I'm giving you statements of fact that everyone around me has a problem with me. There's a vast difference between feeling like the world is against me and knowing for a fact that my interactions with people are problematic. But I couldn't make progress with that, so I'm trying to avoid any kind of inaccuracies in record taking. But as we go along, she's just sort of just being really awkward with me, and whatever answer I give it isn't good enough because she doesn't know how to put that into her words like it's what I've said. And yeah, she said she's going through questions about health and my life and this, that, the other, and she said, have you got any children? I said, no, I haven't. And to be honest with you, I think too many people have children to satisfy themselves instead of thinking about being able to satisfy that child's life. She just lost it at me. Got proper angry. And I'm like, you shouldn't talk like that. My kids are at school, my kids are happy, I'm a good parent, blah, blah, blah. Don't ever talk like that again. Don't ever talk like that, proper aggressive in my face. I'm like, hang on a second, like, I didn't actually say it, I was just sort of thinking in my head, I've been abused as a child. My parents only had me for their satisfaction. I'm talking in terms of my situation. I'm revealing me and how I operate. And how can you then be upset? Why are you bringing up your business? You know what I mean? Like, it was totally inappropriate. But going along explaining things, and then she's trying to put it into her own words, like, he stated that his mood has been variable in the past 2 weeks, and he was unable to give further clarification with this. And exactly, I don't function in terms of feelings, emotions and moods. I deal with reality of facts, and the facts remain, and they remain. It's right there. Well, like, where's it going to go? How is that a mood? And she couldn't grasp that. He presented with alexithymia, as he was unable to identify or describe his emotions, and also appeared dysphoric with a sometimes frustrated, angry effect. She's lied to me. She shouted in my face. She's told me not to say what I say, not to think the way I think, not to behave the way I behave. She's struggling to do her job. I'm having to help her to type. What is the expected outcome? Of course you're going to get frustrated. It's just like, I'm there in a pointless situation, telling her I recognise it's pointless, and she just keeps making it pointless, and then I'm dysphoric and frustrated. Of course I am. You know, it just, I don't see how they can not understand it. It's totally impossible. But then just those silly things like, I say, I need therapy because I do not exist. He stated that his existence has been a problem from birth. He stated he has been deliberately debilitated by people who intended to destroy him or cause him to remove himself. He stated that he needs help with his entire life to make a start and deal with the past in order to create a future. Not amenable to be commenced on medications. So I've said no to medication, but again they keep asking. Again, going on about alexithymia, getting angry and frustrated, no current plans or thoughts to harm himself or end his life, but added that suicide is an option for everyone. Because I was explaining to her, as much as I don't have a plan, it's like answering the door. You know, the doorbell rings, you didn't plan for someone to turn up, you didn't plan to get up, you didn't plan to do anything, but the doorbell rings, you get up, you go and answer the door. You know, like, why is there an obsession with having a plan? I don't need a plan to do it. It will just happen like the attempts have happened before. And there's no way of getting through to him. He stated that he needs help with his life to create a future. He is not amenable to be commenced on medications currently, stating that he was commenced on fluoxetine in the past, but later found out that it could worsen his symptoms in the first few weeks and did not continue with it. Now that's not what I said to her at all, so she's put that differently. I've explained what happened with the GP, where he said that there would be no side effects to me taking it. Right, I haven't got a diagnosis, so therefore I haven't got symptoms. So if I haven't got a diagnosis, I haven't got symptoms, how could I say that it would worsen my symptoms? I didn't start taking it, so how could I not continue with it? You know, it's stating that he was commenced on fluoxetine in the past, but later found out that it could worsen his symptoms. No, I was given the fluoxetine. I wasn't commenced on it. I didn't start with it. At the time I was given it, I found out that it could have had a negative effect on me and caused side effects that I had stated I could not deal with and would be negative for me. So it isn't worsening symptoms. And it's just these constant things where they're getting things wrong. They're putting it in terms that, instead of saying that like the doctor wrongly medicated him, you know, the doctor decided for himself to give him this medication without any proper assessment. I know, let's not tell the truth, because that might get someone in trouble. And it's absolutely crazy. How can you actually make any kind of progress with people who just won't actually let you make progress? You know, I didn't feel like it is an agent delivering a package to an end user on behalf of an agency. I knew for a fact it was. So you see, I make these statements of fact, of reality, that stand as they are. The other person opposes it, attempts to disprove it and discredit it. Then it turns out to be real, but they still want me to accept that it was just a feeling. See, I didn't have a feeling, I knew for a fact. And this is what keeps happening. I make these statements of absolute fact and reality, and no matter how much they try to convince me it's a feeling, convince themselves it's a feeling, convince everyone else it's a feeling, it doesn't fade, it doesn't dissipate, it doesn't get replaced by something. It still stands as an absolute fact of reality after everything. So why are they trying to convince me that it's just a feeling? It is absolutely stupid. I really don't know what am I meant to do. Like, how do you get anywhere with that? Because then once you've got that misinformation, you then need to get that right. You need to put it right, and you just don't get anywhere with them. It's strange, right? They're meant to be there to help you and to take on board the reality of your situation. But for instance, saying that I presented with alexithymia, I looked into what that is, and it is that you don't recognise emotions in yourself and you don't recognise emotions in others. But I do recognise emotions in others. That is one of my problems. People use that sort of guilt tripping, they use their emotional blackmail. I recognise that they'll be too upset if I say that. It's like growing up. There's nothing wrong with you because your brother's going through this. There's nothing wrong with you because cousin this is going through that. There's nothing wrong with you because this is happening in the world. And it's being shown that all these people are in an emotional state that's so debilitating for them because of sometimes their own choices. So therefore, I have to hold myself in a certain way, be responsible for their emotions, recognise their emotions, take on board their emotions, and live as a reflection of the most fragile point of their emotions. How could I have done that so successfully well for all of those years if I didn't recognise emotions in others? I couldn't have, could I? So clearly the fact I've done that disproves this claim of alexithymia. People with alexithymia lack sympathy, empathy and compassion. But I have sympathy, empathy and compassion for every child that's born and every child that isn't born yet. But at the time when I was demonstrating that to her, she was too busy getting angry and shouting at me about her kids. So you see, if she kept her temper, if she hadn't been angry, if she hadn't got frustrated, if she'd been able to do her job, if she'd behaved in a professional manner, she would have then seen that I do not present with alexithymia. So therefore now I have to deal with that with the next person I meet, because I recognise that they're going to have that conclusion in their head already, and they're going to be dealing with me from a conclusion. They're not going to be dealing with me from a question. So therefore I need to tackle that with that person. But then to deny what someone else has assessed of you, you're then controlling, you're then awkward, you're obstructive, you're paranoid if you say that that person's done that on purpose. No one wants to listen that that person shouted at you. No one wants to listen that it says it was difficult to form a rapport. It was, because I'm explaining things to her and she's making no connection to it. I'm trying to connect with her. But you see, what happened again? I had to exist at the point of her most fragile emotions, because she would get upset. And if I didn't carry out the process in a state of shutdown, accepting the fact that the only thing there was room for in that room was her, then it was just going to get worse, and it would just be me who was the problem. What is that other than a continuation of the pattern that I've existed in, the pattern that I'm telling them about, and it's a pattern they won't believe. They won't believe that that pattern exists, they won't believe that I can see it, and they don't believe that people carry that out. How am I meant to get anywhere? How can I then convert that into a feeling? Because you're going to convince me that that isn't actually happening, or that I could feel a different way. It's like I say, with 2 plus 2 equals 4. Well, you could feel like it's 5, because you only feel like it's 4. That is how they're behaving. Grown adults sitting there playing games of let's pretend, pretending that reality and facts do not exist, pretending that they're not logically capable of understanding logic. They can't. They've got no rational thinking. They've got no logical thinking. And this person is meant to be using their analysis, logic, and everything else to analyse what I'm saying. Well, every time they fail at logic, they prove that I cannot trust them to deal with things in logic. Every time they fail to comprehend the reality of the analysis I'm offering them, they prove to me that I cannot trust them to carry out analysis. So that person on their own as an individual is proving to me as an individual that I can't trust them. I couldn't trust her to stay calm. I couldn't trust her to listen to my answers. I couldn't trust her to type up my answers. I couldn't trust her to tell me the truth. I couldn't trust her to interact with me. I couldn't trust her to come to accurate conclusions. And I'm the one with the trust issues. No, I'm putting it there for you. You're the reason we don't have trust. It's that simple, you know. But they need to reflect it all back on the patient. It has to all be the patient's fault. So if you are that patient and you're struggling with that situation, what do you do? And in terms of the support network around you, like, to what extent are they going to believe you when you've got these people who uphold medical professionals as some special amazing thing, and well, the medical professional said, but the medical professional said, but the medical professional said, yeah, but what about what I'm saying? You see, you're trapped in a situation that's being inflicted on you from birth, and then you're trapped by these new situations for trying to sort that out. And then where'd you go when you leave that session? You go back to the people that you're living with, you go back to your family, you go back to these people who have mistreated you, where they can blame you and mistreat you even more for the fact that the situation you're in now is failing. How do you think that helps the patient in any way, shape or form? Because I can tell you for a fact it doesn't. It really, genuinely does not. But then that's what you've been set up for, your whole life. And then when it happens, you're not meant to notice it. How can you not notice it? It's like you see the seasons changing, and then you're not meant to notice that it's autumn and the leaves are turning brown and falling from the trees. You're not meant to notice that there's blossom and it's spring, and you're not meant to notice that it's winter and it's freezing cold. You're not meant to notice that, but you see it happen and it follows a preset pattern and it's the same every time. How can you not notice it? How can you not remember? See how ridiculous it is sometimes. What am I meant to do?